Hi, I'm Dr. Michaeli. I'm a peripheral nerve surgeon. We're going to talk about spasticity today. What causes spasticity? Well, there's various causes. It could be upper motor neuron from a stroke, cerebral palsy. You can treat spasticity in a couple of ways. One way is you could do Botox for spasticity. That will be temporary relief usually, but if it helps and you could avoid surgery, that's always a fantastic option. Aside from Botox, once we get to a surgical option, historically, what used to be done was tendon lengthening, and sometimes it's still required, or you could even do a tenotomy, but then that muscle is never going to work. But it might allow you to have a more normal posture or less pain associated with that spasticity. What I recommend is a partial, highly selective neurectomy. So most muscles will have multiple points of innervation. So if we could de-innervate just sections of the muscle, you can make it just weak enough where you could still use the muscle, but not suffer from that spasticity. So by taking 1/2, 1/3 of the motor connections, we can weaken the muscle enough to where you're no longer in pain, but you still maintain some function. Recovery after surgery is fairly quick. Since we're not cutting the tendon or the muscle and repairing it, we don't need any time for it to repair. So I actually encourage patients to start moving right away. We prioritize function over form. So if there's a little bit of breakdown in the wound, we usually just deal with some local wound care. If that causes a scar to maybe be less cosmetic than we appreciate, we can always do a scar revision later. We move right away. Within 2 days, the patient is showering. There is almost no immobilization period associated with this at all.